One experience that we sometimes have with our patients is this pattern of behavior where we try to help them change and we offer interventions that could help them get unstuck, but our patients don't follow through with assignments and they don't take those steps to actually create that change. And sometimes this is a situation where they're experiencing some ambivalence about change, and there certainly is this notion that we can use motivational interviewing as a way of resolving that ambivalence and helping them move to a more action-oriented phase of treatment. For some patients, however, this pattern of behavior is related to what Dr. Robert Leahy referred to as strategic self-limitation. And strategic self-limitation is where patients deliberately limit the amount of change that they're willing to take and participate in part because they are afraid that if they take the risks necessary to facilitate that change, that they will experience further loss or further suffering or further regret. And that feels too scary for them, and so they don't want to press forward for fear that that will actually become a reality for them. But there's something else that also is accompanied by that fear, and it's this idea or belief that if those consequences that I'm afraid of, if I take these risks that could potentially help me get unstuck, and if these consequences actually come to fruition, it will be so overwhelming, it will be so overbearing for me in my life, and I won't be able to handle that. And in those cases, what I'll often do is I'll talk to patients about this notion of strategic self-limitation, but I'll also try to help slice those risks a little thinner, to the point where patients feel like I could take those incremental steps towards change. I will also sometimes confront the belief that if the worst case scenario did materialize in their life, what part about that couldn't they handle? Sometimes this idea that's, that I'm afraid and I can't do it and it'll be too scary or the consequences will be too great, it's all tied up and enmeshed with this vagueness. And when you get them to be more specific, if the worst case scenario actually happened, what part about that specifically couldn't you deal with? What part about that specifically couldn't you handle? And as patients are able to start breaking that down and have some specificity around some of those fears, it can often help them start to confront them in a way where they realize, you know, that would be really awful, it would be really miserable if that happened. But you know what, it certainly isn't going to be fun, and it's going to be painful, but I can survive that, and it's not going to be the end of it as I know it. And so this can sometimes be helpful to help them get unstuck and start to take those steps towards incremental change in their lives.